ways that I see patients with ADHD presenting. Very often they'll come in and they'll say, you know, doctor, I think I have ADHD. My wife read an article about it, and then I did, and you know, or my son or daughter has it, and I've seen them get treated for it, and boy, are they better. And I'd like to be evaluated also.
My son's ADHD was diagnosed when he was 6, and I call it his gift to me because it eventually got me to where I am now. After so many years of researching and looking for answers and going to doctors, I started to become very clear about some of these behaviors existing in my world as well.
Another way they come in, more unfortunate, is in chaos. Half the patients that I see or more present with ADHD in chaotic life events. And unfortunately, the symptoms that drive these events are related to the disease: inattention, not following through, job loss, impulsivity, and hyperactivity can distract and cause problems in relationship.
There were a lot of problems that I recognize now with memory and with retaining information from verbal sources. So college was a problem because I wouldn't glean anything from my lectures. I used to interrupt a lot with people, so I didn't realize how important it was to pause and wait for somebody else.
Many of my patients with ADHD have difficulty in their marriages. Inattention may be one of the worst things in a marriage. They make great dates. They're into everything, but they may not make great mates because they forget a lot and they procrastinate. If the wife has a honey-do list, unfortunately, it's frequently not done, not finished, and can be a great source of irritation. Arguments, anger problems are contributing as well, and unfortunately the rates of divorce are almost double for patients with ADHD. So this is something that I always entertain when someone comes in with a chaotic life event. I entertain underneath, might they have something driving that event like ADHD? And the same with the third way, which is with comorbidities, and the comorbidities frequently mask ADHD. So we're talking now about major depressive disorder, anxiety and anxiety disorders, as well as substance use disorders. If we don't look further beyond just that disorder and look to see what could be causing it, we'll miss a lot of ADHD patients.